Good evening, everyone. Welcome to the webinar on incorporating exercise into daily life while managing chronic conditions. As Michelle so kindly introduced, my name is Dylan Grubb, and I am an accredited exercise physiologist. I'm the director of Equipped Allied Health, a community-focused allied health service that, after just over 6 months ago, began operating at the Chifley Health and Wellbeing Hub. At the heart of our service is the Equipped Community Gym, a space dedicated to providing both general exercise and also clinical exercise services to support the diverse needs of our community. Since launching, we've been committed to helping people move better, feel better, and live healthier lives, no matter their age or fitness level or medical condition. Alongside my work at Equipped, I also actively involved with Exercise and Sports Science Australia, the peak professional body for exercise science and clinical exercise physiology in Australia.
I knew it would have exercise in the title. See, I got that
Definitely,
part right.
exactly. The role works within the ESSA's national office and collaborates on advocacy efforts around the country, promoting the exercise in the role of healthcare. It gives me great insight into the landscape of our profession and probably the critical role that exercise needs to play in the long-term health outcomes. So, a little bit about me, a little bit about my background, and yeah, definitely started as a sports trainer there at one stage, working with the Belconnen Magpies, doing strapping and things like that. So, why are we all here tonight? We all know that exercise is beneficial. It's something that we hear all the time, but for many people living with chronic conditions or chronic pain, the idea of exercising can feel overwhelming, intimidating, or even impossible. The fear of making things worse, not knowing where to start, or struggling with motivation can all be barriers to movement. Tonight we'll break down these barriers, reframe the way we think about exercise, and my goal is to help you feel confident in your ability to move, regardless of your health condition, so that exercise can become a safe and enjoyable part of your life, not something to be fear or avoided. Our discussion will cover four key areas: understanding how chronic conditions impact the body and how exercise can help, understanding chronic pain and its relationship with movement, evidence-based strategies for and guidelines for safety and effectiveness, and strategies to build sustainable and enjoyable exercise routine. As Michelle said, we'll finish off with a Q&A, where I'll go through some of the pre-submitted questions and also open the floor to anyone who wants to revisit a part of the presentation that they might enjoy. And it's a great opportunity to ask anything discussed tonight at any stage throughout. So I encourage you to make the most of my time, and yeah, any questions, please just jump at any stage. My screen's over here, by the way, and I'm looking here, and yeah, if it doesn't look like I'm watching, it's just because I'm looking at the slides. Before we dive in, I want to take a moment to highlight the role of accredited exercise physiologists, AEPs, as we might be referred to, as I know many people may not really be familiar with what we do. So an accredited exercise physiologist is a university-trained allied health professional who specialises in clinical exercise interventions for people with chronic health conditions, injuries, and people living with disability. Unlike general fitness professionals, AEPs work often in the clinical capacity, often alongside other healthcare professionals, and typically develop individualized exercise-based programs tailored to someone's medical history, their physical function, their health status, and their goals.
That is a really
If
good point because a lot of people just think like personal trainer and
mm,
exercise trainer,
mm.
but there is actually a lot more to exercise physiology. It's a whole degree. It's got a whole lot of extra scope in the health and health and exercise. So
As
it's
soon as you step away from that apparently healthy population group, it's really important that you engage, yeah, with either an AEP or a physiotherapist. Like, there's no denying that we do share some common scope of practice, and we could talk over some of those differences. But for the time being, if anything in tonight's discussion resonates with you, I strongly encourage you to go seek out a local AEP for guidance and support. So whether that's someone at Equipped or someone broader, there's no problems there as long as you are engaging. So AEPs will work in a number of settings. They'll work in hospitals and private clinics and aged care facilities. So you'll find them out in
mm,
the community quite commonly as well. The key thing to remember is that exercise is it's not about fitness, it's about health. And when exercise is used strategically and with the right guidance and at the right intensity and in the right way, it can be one of the most powerful tools that we have for improving physical function, pain management, and overall quality of life. So it can be a little bit technically challenging and it can be a little bit scary, but once you feel empowered, it's everything. So um, with that, let's get underway. A little bit dense on the slides here where you can read while I sort of blabber on, but if anyone wants to stop me, like I said, feel free. So a chronic condition, long-term health issue that persists for months or years, affecting daily function and overall well-being. Unlike acute illnesses which come and go, chronic conditions require ongoing management and can be influenced by lifestyle factors, medical treatment and rehabilitation. While these conditions may present challenges, they do not define an individual's potential for fulfilling active life. And with the right strategies, including exercise, symptom management, and professional guidance, people with chronic conditions can maintain and dramatically improve their quality of life.
Dramatically. I like that. You almost
Dramatically,
said drastically and dramatically at the same time. So now we
both
can actually just say dramatically.
both of them.
Love it.
Chronic conditions affect all demographics, though more prevalent in certain population groups due to genetic, environmental, and lifestyle factors, and obviously age being probably the most common cause for chronic condition. Some of those chronic conditions that we might all know are up on the screen there. So we're thinking cardiovascular disease, metabolic disorders, respiratory conditions, musculoskeletal disorders, neurological disorders, mental health conditions. It can be a combination of these. It can be one of these. Typically, one comes with a few, and so
Yeah.
they typically have comorbid factors
I was going
that
to say the
cause.
fun word for that is comorbid, but I always kind of, I don't know, I don't love the word comorbid, but yes, they
And
often
you'll typically
come
have
together.
a couple at the same time. So, and if you're at one, you're typically at risk of developing others as well. So, the conditions can vary in severity and impact, but they all share the potential to reduce physical activity due to pain, fatigue, or potentially fear of exacerbating the symptoms. So,
Mm.
uh, medical and exercise science, however, constantly demonstrates that exercise and structured exercise and individualized structured exercise are key to managing and mitigating the effects of chronic conditions. So chronic conditions can affect pretty much every system in the body, leading to widespread physiological changes that influence so many bodily functions, including mobility, function, and overall health. The specific effects vary depending on the condition, but there are several key ways that come across multiple chronic conditions that have key impacts. So, fatigue and low energy levels is one of the most common symptoms of chronic illnesses, often resulting from systemic inflammation, poor oxygenation, deregulated metabolism, and the medication side effects that commonly are a part of many chronic conditions, such as beta
Mm.
blockers for hypertension or antidepressants for mental health conditions as well. They can cause drowsiness and reduce motivation. So that's quite common across the myriad of chronic diseases. Pain is a significant barrier in many chronic conditions. So arthritis, the most common chronic condition. It's inflammation of a joint that just
Mm.
leads to stiffness and discomfort that reduces pain. That causes pain that reduces the rest. Mobility, strength, and coordination. So we're thinking conditions such as osteoporosis can lead to increased risks of fractures and things like that, or multiple sclerosis and Parkinson's diseases, things like that with neurological sort of side effects as well. So likelihood of falls and injuries picks up in those cases. So it's really important that we understand the impact there. And then, the psychological barriers that sort of come with chronic conditions as well. So people avoid exercise due to fear of pain, fear of injury, or worsening symptoms. So it's a cycle, it's a vicious cycle that leads to inactivity, but it also leads to exacerbated symptoms. So it's important
Mm.
to intervene as early as you can in the chronic disease, and we try to prevent rather than treat as much as we can. So a bit to take in there, but the message being that the chronic conditions do share a number of systems that they affect, and knowing that can be the first part to empower you. Despite the overwhelming evidence supporting exercise as a powerful tool, there's always some myths that continue to persist. So the misconceptions
Myth
often
busting. I love a bit of myth
discourage
busting.
individuals. Exactly. We're trying to break down the myths. We're trying to break down the barriers for people to exercise. So, um, Rest being better than exercise. It's a vicious cycle, like I say. And people want to rest to get that short-term relief. However, that long-term flare-up in symptoms obviously leads to that some of those things listed there. So muscle atrophy and joint stiffness, and even reduced fitness levels that just put you further back. Exercising making the condition worse is a big fear. And while we do need to be careful of improper exercising and making sure that our technique and our dosage is correct, prescribed exercise programs that are done appropriately don't exacerbate chronic conditions. And tailored exercise programs will improve function, they will reduce your pain, and they will slow that progression down. People with chronic conditions should avoid strength training. This one's a big one. This one we obviously focus on quite intensely with the gym. We think that resistance training should become a part of most people's healthcare. And while we all focus on campaigns to improve our cardiovascular fitness, getting our 10,000 steps, getting our heart rate up, getting that resistance side of things is very important as well. So it enhances muscle masses. It prevents age-related decline of muscle. It improves your bone density and can reduce your risk of the development of bone-related conditions and then fractures that can be associated. And then the myth of exercise, the intensity of exercise needing to be intense for it to be beneficial, which is simply not true. So, only high intensity workouts yielding results is not true. And, even low and moderate intensity exercises can be highly effective. So we're thinking brisk walking, we're thinking even seated exercises and modalities like Tai Chi and yoga to enhance the whole life. Exercise comes in on a number of benefits. So it's never been really disputed that exercise has a strong place in the evidence base for the benefits across multiple health domains. The big one that everyone understands quite well is its cardiovascular benefits. So we're thinking about lowering blood pressure, reducing arterial stiffness, improving circulation, lowering the heart disease risk and stroke risk. Exercise also helps regulate things like your cholesterol levels, and is always, really recommended in those cases of cardiovascular health. Exercise enhances your insulin sensitivity, improving your glucose uptake in type 2 diabetes especially, and in resistance anaerobic training is a great way to reduce your HbA1c levels, to look at a longer term picture of your health, and lowering your long-term risk of diabetes related complications. Joint and musculoskeletal health. There's always improvements with exercise to reduce arthritic pain and improving mobility, and weight-bearing exercises to enhance bone density, and yeah, again, mitigating that risk of osteoporosis related sort of fractures. The mental health and cognitive benefits should never be sort of underplayed of exercise. So we get all those feel-good chemicals released, endorphins, improving mood and relaxation across the board, and it also improves your sleep quality. So the cognitive function throughout the day benefiting from the decline in sleep function. And sort of back to where we were with fatigue management, it can also help manage sort of chronic fatigue and enhance overall energy levels, especially in conditions like chronic fatigue syndrome and fibromyalgia. In a weight management side of things, exercise doesn't always have to be used as a weight management tool, but it can aid in a weight management and disease prevention side of things, where it's maintaining a healthy weight, maintaining a healthy hip and waist circumference, and preventing obesity related and overweight related complications to reduce strain on the skeletal system, really. Again, none of these should define your ability to stay active, though. Movement is the medicine that we all should be looking for, and when implemented correctly, exercise can be one of the most powerful tools for long-term health and well-being. Like, we can go into a lot of detail with chronic conditions, and even some of the pre-submitted questions were around specific chronic conditions. So if anyone wants to throw something at the end of this first stage, we're just about to move into the chronic pain sort of side of things. So we'll come back and we'll tie some overarching things across the both, but the difference between chronic exercise and chronic pain does differentiate here. So yeah, Michelle, we might just keep steaming ahead, but we'll come
Yeah,
back.
keep skimming ahead. I think it's been, yeah, good.
Um, So chronic pain, very much like chronic condition is pain that lasts beyond the expected healing period. So, it's typically presenting for more than 3 months. And unlike acute pain, which serves as an immediate warning signal for injury or illness, chronic pain remains even after the original cause is healed. So, it can result from past injuries and autoimmune disorders and nervous system dysfunctions, or specific conditions such as arthritis, fibromyalgia, and neuropathies. Chronic pain has always been historically viewed as a purely physical issue, but modern research continues to highlight the complex interplay between these features. So, the biological, psychological, and social factors, a
Mm.
framework now known as the biopsychosocial model of pain, has
Mm-hmm.
become championed by researchers around the country. Lorimer Moseley, David Butler, emphasising that the pain is not solely dependent on tissue damage, but it's a dynamic experience, and it's shaped by so many, processings of the brain, emotional states, and environmental influences. So, understanding pain through a different lens allows for more effective management, and the therapeutic role of exercise comes in here. So,
That's so
we.
very true that there's so much more to it than just
Mm.
the physical.
And
Yeah,
this
it
is
has.
this is something you'll find as a really common scope of practice within our AEP setting, where we're using that biopsychosocial model of chronic pain. Um,
Mm.
and one example I think that I always like to give my clients when we start this conversation is regarding like phantom limb pain. So phantom limb pain was some of our biggest breakthroughs in limb in pain sort of science. And it really came from the understanding that someone could lose a limb, could lose an ankle, and could still be feeling ankle pain. And very
Mm-hmm.
quickly we worked out that, hey, this isn't a process at the ankle, this is at a process
It's
at
your
the brain.
brain.
So,
The brain is
um,
so powerful. Yeah, and it
it's
can
yeah.
literally tell you that that arm is still itching because that's the neurological pathway that developed when a set of circumstances occurs. Yeah, it blows my mind how amazing our brains are and how you have to rewire them after something like loss of limb to
Mm.
yeah.
And we
Anyway,
don't have
could talk
we
about
don't
that.
have pain receptors. We have mechanicoreceptors, we have heat receptors, we have all these sensors in our body to tell our brain what to do. But there's never actually a pain sensor. So the pain is the output. The pain is what the brain spits out as the answer to all the incoming signals. So, we can definitely alter that. But other influences can alter that as well. So the biological factors, we're thinking tissue damage, we're thinking structural changes and inflammation. Um, that's very common. But then you start to add in psychological factors, anxiety, depression, fear of movement, and we can amplify the pain
Is
experience. So
kinesiophobia fear of movement?
it is.
Is
It's a
that what
fear
that
of
means?
movement. Exactly right. So,
Wow. Okay. An interesting word.
kinesiphobia, fear of movement, and becomes, if an individual believes movement will worsen their pain, they may avoid exercise, leading to deconditioning and greater disability as part of a really vicious cycle. So, it's really important that we recognize those factors.
Yeah.
And we really recognize that the brain can be like, and again, another analogy that we might throw to our clients is if you had your guitar plugged into an amp in the wall, and you were strumming your guitar and you had the amp turned up to full max, it would be, it'd be firing away, it'd be blowing the room up with sound, even if you were strumming the same beat. So if you turn your amplifier down, if you turn the sensitivity of your brain down, you can manage that noise without changing the input. So again, you could throw social factors in there, work stresses, financial burdens, social supports, family deaths, friends, having issues, and all of these further exacerbate your feelings of isolation and
Mm.
distress that ultimately cause more chronic pain. So, by addressing each of these elements individually, chronic pain management becomes more effective, and exercise plays a crucial role in disrupting the pain cycle. So, we can retrain the brain's response to movement, and we can try to get people out of a very, very, very vicious cycle that's
Mm.
influenced by a number of pharmaceutical interventions as well that make it a little bit more challenging.
Mhm. I know exactly what you mean.
Hmm. Despite fears, though, exercise may worsen pain. Exercise is constantly demonstrated in research to show that movement is beneficial for chronic pain sufferers. So we reduce pain sensitivity. Again, those release of those endorphins, those enkephalins, those natural painkillers, movement, decreasing central sensitization, turning that amp down in the brain, making the nervous system less reactive to pain stimuli. It improves your mobility and your flexibility. So chronic pain often leads to muscle guarding and stiffness. So
Mhm.
gradual, slow exposure to movement
Mhm.
through gentle stretching, mobility exercises, swimming, yoga, can help restore those movement patterns and prevent further deterioration. Strengthening the supporting muscles. So weak muscles lead to compensatory movement patterns. So we don't want that undue stress on joints and soft tissues that weren't currently in the ones that we were targeting. So targeted strength training distributes load more evenly and reduces strain on those vulnerable areas. Enhances nerve function, also decreases inflammation, and then boosts the mental health and pain resilience. So, again, pain's so tied to emotional well-being, and anxiety and depression can really heighten pain perception, and create that vicious cycle I was sort of so commonly referred to. It enhances mood, it increases serotonin, increases dopamine, all while improving your sleep quality as well. So it's all part of it, a really nice way to help regulate pain perception. The pain science, like I said, has come a long way. Some of these figures, Mosley and Butler, have advocated for things like pain neuroscience education, P&E, as a core component of chronic pain management. So we're thinking of training that sort of teaches individuals that pain's not the reliable indicator of tissue damage anymore. That movement can be safe, and even when it feels slightly uncomfortable, understanding that the brain can retrain helps individuals regain confidence in their bodies. So, for those living with chronic pain, it's not easy, and it is a really, real experience that can be really challenging to get through.
Yeah.
So, key is graded exposure and really consistent approach that's gentle enough to make it bearable. So, the approach is low impact. It's cardiovascular exercise. It's walking or swimming. Even if you need to take the load off the joints completely, things like hydrotherapy and acroaerobics can do that for you. We're just trying to get circulation going. We're trying to reduce stiffness. Strength
Mm.
training, starting at a light level, can be really good to build resilience in muscles and joints, especially if fatigue is an issue. Again, strength training can actually be a little bit easier to do than the aerobic stuff. If fatigue's an issue, pulling on something for 12 reps can be much easier than 5 or 10 minutes on the treadmill for some people. Stretching, mobility work. So these things that can be done quite regularly, quite often, just to sort of help you improve body awareness, improve relaxation. And again, those can be things like yoga and Tai Chi and Pilates, but can also just be self-derived classes and things like that. And there's a million resources out there now for exercise classes for so many different factors. And then the big thing is to pace yourself. So we're looking at strategies to balance activity and rest, to make sure that you're not having flare-ups and to prevent any adverse effects to exercise. Exercise, again, though, is one of the most powerful tools for the management of chronic pain and just similarly to chronic conditions. By addressing the physical and psychological aspects, though, of pain and movement, you can break the cycle of avoidance, build confidence, and improve your well-being. As researchers highlight, pain doesn't always mean harm, and movement can be the pathway for many to recover. So, starting's challenging and it's not easy. So, the right guidance is usually essential. And again, you might look to refer to an exercise physiologist or a physiotherapist for that assistance to reclaim that part of your health. Um, if we've got some stuff later in the end for some red flags as well. So we will come back around to when to actually listen to that body and when pain is the reliable indicator of damage as well. So the physical activity guidelines are quite well developed. We've got some for Exercise and Sports Science Australia. The health department have their own recommendations. It plays such an important role in chronic conditions, so it is really important to follow some of these guidelines. So with aerobic, we're aiming for 150 to 300 minutes. Two and
My
a half,
brain can't, yeah, I was going to say, my
yeah,
brain
two and a
can't
half to
compute how
five
much that
hours.
is.
Yep, five
What is
hours a week.
5 hours
Um,
a week? So is that
5 hours
it's
a
like half
week.
an hour a day, right?
Half an hour,
Ish.
yeah. So 2.5 hours. Yeah, no, it's about half an hour a day. If you're doing that moderate intensity level, or you can shorten it and we can make it more vigorous. 75 to 150 minutes there. Sessions can be broken down though. 10-minute increments. Slot them into the
Hmm.
daily life a little bit easier. And there's no reason to say that exercise in those short bouts is less effective. Evidence won't support that either. Individuals with cardiovascular conditions, it's really important though that they have graded progression to prevent any excessive strain on the heart. So, important for them on the aerobic side of things. If you're exercising with a cardiovascular condition, that you start light and you build up. You don't just jump to those 75 to 150 minutes thinking you're gonna get your minutes in. It's great. It's better to go gradual. Again, strength training comes in really hot. Resistance training twice a week is the recommendation to maintain muscle mass and joint stability, and that creeps up to 3 and even 4 times a week for certain population groups. So, it should target major muscle groups. It should use body weight, resistance bands, hand weights, free weights, or gym machines, like we'll show you at the end of the presentation. And you should use progressive overloads, so gradually increasing that intensity to improve your strength without causing injury. So don't just jump all the way to what you think your one repetition max is. Start a little bit light and build up over a number of sessions to prioritize your health. There's some specific considerations for strength training based on certain population groups. So things like people with osteoporosis should prioritize things like low impact, joint friendly movements, avoid movements that involve flexion and rotation of the spine, and some specific things that any allied health professional would be able to help you with.
So the key message is you've really got to clue into what your body needs and what your health conditions will
Mhm.
benefit from.
Well, most
Yeah.
people can draw that conclusion themselves. They quite understand the benefits here, but other
Mm.
times they might want to come and get that education piece from an allied health professional to say, hey, this is the education piece that I need. Here's the evidence that supports it, and this is why I want to do X, Y, and Z. So there is some recommendations for flexibility and mobility and balance as well. So these ones can be done more closely to daily, and especially in the balance training components, it becomes nearly essential to be completed daily for older adults and individuals living with conditions that they need to prevent falls. So things like neurological conditions,
So it's
and then
just
the
all
strength.
it's got to become part of your routine, basically.
Exactly
Yeah.
right. Yeah, it just got to become now part of the day to day. So, maybe it's waking up and doing your mobility and doing some balance while you're standing at the kettle. You're
Mm.
doing some heel to toe walking down the hallway a couple of times a day. You're doing some movements to improve your coordination. But at least you're thinking about being up on one leg or using your walker a little bit less or using your walking stick a little bit less. Wherever your
Yeah.
current level of balance and mobility is, just trying not to become complacent and accepting of that level. And I guess trying to challenge it in a safe environment. Please don't do your balance training on one leg in the shower, and that's not the place
And
to
it's
do it.
not what the message is. Nope.
That's not what the message is. The message is, controlled environments, and even some photos later in the session. We'll talk about some facilities that can improve that as well. So. And then yeah, feel free to jump into group classes and things like that might tailor specifically to these kind of things. This one's a bit dense because there is so many recommendations. So, like various chronic conditions have various clinical recommendations. This is what an EP goes to uni for 4 years to do. So to squeeze it into a slides, it's a disrespect
Your
to the
whole
profession,
degree
but
on one
it's
slide. Yeah.
exactly underplaying it significantly, significantly. But what we do have on this slide and what I had on the slide before, is the links to the HealthGov website there, which has all of those recommendations in there in detail. And then on this next one, we've got the resource library from Exercise and Sports Science Australia, which has the publications of our position statements. So S has come out with a position statement on asthma, a position statement on hypertension, and in that position statement has the the exercise effect, the exercise considerations, and things to consider. So if you have a specific condition and you want to find that detailed understanding of what does my condition really warrant in an evidence-based practice setting, you'd be looking for these kind of publications. So it'll speak to very similar dosages, it will speak to very similar timings and things like that, but it will have some, some recommendations, and it'll have some considerations and also some contraindications. So if you have X, Y, and Z, it might not be beneficial for you to be exercising it a certain way. So it breaks it down. There's some stuff here on this slide: cardiovascular conditions again, metabolic, respiratory. Oh, I'm just going through.
You pressed the
Um,
buttons. I will send this presentation out, and I will put
Perfect.
all of
Yeah.
these links in for the different conditions and how to find those position statements, so you don't have to frantically try to write down or
Mm.
remember any of this information. This is just for your viewing pleasure, but it will be
Just
coming in an email.
just some things there, to be things like monitoring blood sugar levels in metabolic conditions, monitoring oxygen levels in respiratory conditions, focusing on specific muscle groups in specific musculoskeletal conditions, and having a generalized approach for some of these, more common chronic conditions. Look, if you have a very specific, ultra rare condition, we don't have a position statement on it. We fall back to general recommendations and we try to adapt those, but ultimately, ESSA does come to the table, and as the peak body represents what Australia should be pushing for in this regard. So here was those safety precautions and some of those things to consider. So every individual's so different, and an effective exercise program needs to be tailored to personal needs, and personal health conditions. So an exercise physiologist or an allied health professional is always going to consider your medical history and your symptoms, your physical activity preferences, and your motivation levels, your functional capacity, and your movement limitations, and what's around you. Do you have support network there? Do you have carers? Do you have another clinical team? Do you have specialists? What might be there? A health professional and AEP can create a personalized plan that addresses all of those needs, and can be really beneficial for individuals with chronic conditions to gain that benefit from consulting with a qualified health professional. So we try to make this as accessible as possible, equipped as affordable as possible. There is AEPs, there is physiotherapists in a lot of public health spaces, and there is accessibility in these. That's what healthcare consumers, I assume, can help us with here.
I'm going to
Finding
put some links.
accessible,
Yeah.
yes,
Yep.
some
Well,
accessible
that's why we're
options here,
offering
and
this fabulous
exactly.
free webinar.
Exactly. More information, more education, to empower people, to seek that level of self-management that everyone deserves in their health conditions. So some of the groups, people recovering from heart conditions or stroke coming out from inpatient or outpatient services in the hospital, individuals with diabetes, especially if they've never exercised before, it can be really challenging. People with
It can
severe
be
pain.
daunting. It can be
Yeah,
daunting.
yeah,
Yeah.
yeah. And especially if you don't know even just the levels, seeing that,
Mm.
if I'm at 7 millimoles, and can I exercise? If I'm up at 16, am I about to go hypo or hypoglycemic? We've got those cutoffs as a profession. We've got those cutoffs as a company in the gym for individuals to follow. But again, anyone with any severe sort of condition might want that guidance there. So we can
Mm.
create a safe and sustainable approach to your sort of physical activity. And while exercise is so highly beneficial, it's important to recognize some of the warning signs that indicate when to stop and when to seek sort of medical intervention. So, chest pain or discomfort, we're thinking any pressure in the left side of our chest, even that resonates up into our neck, into our shoulder, down our arm. Any severe shortness of breath that doesn't resolve with rest. So if you're working out and it's going and it's getting worse, and you stop and it's getting worse and it's getting worse. The opposite, if you go dizzy, you go lightheadedness, you start thinking you're going to faint, or you do faint. If you have any severe muscle or joint pain beyond what would typically be exerted, so things like exercising with active fractures and in unstable situations, that pain response is real and really needs to be taken accounting for, especially if you've got an acute injury. Pain is really important there as well. Heart palpitations or irregular heartbeat, any changes to what you perceive to be your regular way of bodily function. And we'll also in the gym, have exercise cutoffs for things like your blood pressure, your oxygen saturation, and your heart rate even. So sudden weakness or numbness, especially on one side of the body. We're thinking, stroke risks and things like that, or excessive fatigue that lasts, hours or days post-exercise that can't be explained by your health professionals. If these symptoms occur or you're exercising in a non-supportive environment, it's so important to seek a medical, assistance and seek sort of further support there. So. Building a sustainable plan is a tough one, and many people can struggle to maintain an exercise routine, whether that is due to pain or chronic conditions, or fatigue or time constraints. There's plenty of barriers in the way of exercise. So a well-structured approach can help you. It can help build consistency. It can make exercise an enjoyable part of your life, and it can develop a routine that's sustainable that works for you. And it should work for your goals. Whatever you think you'd like out of exercise should be what motivates you to get there. So establishing those clear goals, those achievable goals to help you stay on track, and stay motivated, can really be helpful. So make sure they're specific, make sure we can measure them. Don't set something that's too unachievable. You want something that's relevant maybe to your lifestyle or your function, an upcoming holiday, lifting the grandkid or whatever it might be. Something there can be really, really motivating. And then set a timeline, set a deadline so that you've got something to work to. So instead of saying, I want to exercise more, say I'm going to walk 10 minutes every morning for the next 4 weeks. And then, and increase that duration by 5 minutes a week. It doesn't have to be a broad goal that means really nothing. It needs to be something a little bit more deliverable, something a little bit more specific to motivate you. So we all know we want to exercise more. We all know we want to do those big goals, but it doesn't help us reach them. So if you've got a distance or a journey, people will come in saying they want to walk a kilometre around the block. They want to just walk down the length of the parallel bars unassisted. We need some measurable goals there. So find something enjoyable. Don't do something you don't like. The best workout is one that you enjoy, something that you look forward to, something that aligns with your life, your interests, your family, your friends, your support networks. You love music, go and do Zumba, go do a rhythm-based class. If you like nature, don't do exercise inside. If you want to socialize, come to the group classes, come to a gym. And if you want that competitive sort of side of things, there's plenty of options out there for sport-based activities. And, pickleball's the hot craze right now. So
Yes,
go and play
everyone is
some
pickleballing.
Go and
Pickleball's
play some
gone nuts.
pickleball somewhere. Go play some tennis, I don't know, whatever motivates you, and you don't want to get too much put in your
You
mouth. So
think of your little dog's face looking at you, thinking,
yes,
I want to
yes,
go for a walk. Take me for a
exactly.
walk.
Yep, yep. There's barriers come up at every point. That's what a health professional will be there to help break down. If you've got that lack of time, maybe break them down. Try to do those 5 or 10 minute blocks. If you're in pain, we got to try to modify it. We got to try to find a level that works, and using supportive environments, using supportive clinicians. If you're
Mm.
fatigued, we need to try gentle activities. Again, thinking yoga, thinking stretching, thinking that stuff that doesn't exert you too much. Because even small movements are going to lead to that sort of long-term growth. And it's going to be so important just to sort of stay consistent, and sort of be on that journey for a long period of time to see its benefits. So some tips there. You can schedule your workouts like appointments if you really want to be held accountable. Some people like the flexibility of exercise, and some people want to treat it as a non-negotiable. You got to push comes to shove, and it shouldn't overwrite your lifestyle, but can be a really good way. Tracking your progress or having someone track your progress for you, having a clinician track it, or having a team track it, or you using a journal or an app or a simple calendar, can be really good to log your workouts. Do it with a friend, exercising with a friend or a trainer or an exercise physiologist or whoever it might be, just to keep you committed. Having you sort of maintain accountability there. And definitely reward yourself in the progress. So, a fun activity, you've met your goals, treat yourself, a nice piece of workout gear, a massage, just, celebrate the small wins. So if you do something good, make sure you celebrate it, because it's progress, and progress is about persistence, and it's not about perfection. So focus on what you can, do today, and rather than what you missed yesterday.
I like to get my eyelashes tinted as my little treat for when I've met one of my health and fitness goals.
There
That's
you
my
go.
that's my
There
happy
you go.
place.
Walk 5 minutes a day, and then you can get your eyelashes
Get
done.
my eyelashes tinted.
Um, Exercise is such an important tool for managing chronic conditions and pain. It enhances mobility, it reduces symptoms, improves our overall well-being, and it empowers you to live a healthier, more active life, especially as we age. The key is to find a routine that works for you, works for your body, fits your lifestyle, and feels sustainable for the long term. Before we get into the Q&A, I encourage everyone just to start small, listen to your body and build up at your own pace. And movement should empower you, not feel overwhelming. I do want to take a moment just to show some quick pictures of our facilities, give you an idea of what access to the Quip Community Gym could look like and how our clinical teams can support you on your journey. This is just to reference what a gym and a facility may look like if you engage in the community. So we've got a beautiful new space now, and we've fitted out our community gym with a range of cardiovascular equipment as seen in the top two pictures here, a range of treadmills, upright bikes, rowing machines, some more accessible equipment on that right photo, recumbent sit back bikes, arm ergometers that have wheelchair ramps, and a wheelchair bike just off frame there that you can't quite see. There's our clinical
That looks
treatment
like
room.
slightly daunting, but remember that there will be
It,
someone there showing you
yes.
how to use it all. Like it's
To
not
be
just free, off
Yes,
you go.
yes. It looks so nice. I'm so proud of that. It looks so good, but it does look scary at the same time. So,
Yeah. If you're not used to
don't.
gyms, it's a
If you're
bit
not used to
daunting.
gyms, there's a lot there, and there's no one in there, which is nice. That makes it look less daunting. But with some social, with some people around, it really fills the space. If we do sit down for a clinical consultation, we do it in our treatment room there. So, just the expectation of what you'll see there. This one's a little scarier again for those who don't like
Ooh.
resistance training, but this is our pin loaded machine. So there's 12 strength machines in our gym that you can sort of get around the room. They're all pin loaded and they're all just easily accessible. Get on and pull, get on and push. Some of
Oh,
them a
I
little
can
bit
see a
more
little person
challenging.
over there, and then there's a
Yeah.
lady there, someone, I don't know if that's a lady or not, but someone helping. So you'd always
That's
have like a,
exactly. That's Kyle, one of our exercise physiologists, working with a client there right before I took some photos. Just showing someone how to use it. So our facility includes, instruction on how to use these machines, and we've got some ways to make it a little bit more enjoyable. We also provide all the accessories in that right photo. You'll see all the hand weights, balls, bands, ankle weights. It's a little small to see, but anything you might need, we will provide so that you don't have to have it there for you. Um,
there's
and
always
then
someone there, isn't there?
there's
Pretty
someone
much.
there from 7 till 6, so we've got an
Yeah.
exercise physiologist on site for the whole time that we're there, and so we provide quite a unique model where there's someone on the floor at all
Mm.
stage,
Yeah.
and then even if someone's working one on one, there's someone else there as well. So yeah, it's the whole day. There's staff there. This is something that we really enjoy, sort of seeing our clients work within. So this is a clinical rehab staircase. It works, people just to train functionally through a staircase that's Australian building code. So if you can do this staircase, and you should be okay with what you find out in the community, and it can just build confidence in a supportive environment before you take it out into the big scary world.
What's
And
this
then that's
blue blobby square in the
yeah,
middle?
it's a big raised stretching area. So we don't,
Oh.
we won't send everyone to the floor to do their mat exercises. It becomes a bit of a barrier for some individuals to get on and off the floor. So we bring the floor up, and it makes a really good opportunity to, either just to sit on the edge of it and do your sit to stands, or lie down and do your glute bridges, your stretching, your mobility work there. And it's got a padded surface, but a rough, like a firm border, just to make it nice and easy for that. So that's where
Hmm.
everyone will do their balance exercises. That's where people do their gait training if we're thinking about, post-stroke rehab or return to functional activities like climbing the stairs. We
Wow.
have a
Amazing.
we have a clinical exercise group fitness room, sorry, which in these photos is set up for Strength for Life, which is our initiative run through
Oh,
Council of the Aging
through
ACT
Kota.
through CODA, exactly. So
Yeah. Yeah.
We run a progressive strength training designed for older adults. Runs Monday, Wednesday, and Friday, and this is the layout of the room. So we close the doors. We make it a little bit more intimate. We've got an exercise physiologist there to like supervise the session, up to 15 participants, but it's usually around 8 to 12 participants. Working with therabands, hand weights, ankle weights, doing balance, doing group warm up, group cool down, some socializing, just to take the scariness out of the exercise a little bit. We're not using those machines just yet. This is the first stage. So on the back of an
Awesome.
assessment with our team, you'll get a program that you can do in this environment, and there'll always be someone there. And again, all included in our membership pricing. There's no sort of add-ons to all of these services. It's just part of the offer. And the last thing being our
No,
little
I was
social
going to
area.
say,
So
yeah, this is the most
yeah,
important part. Where's the coffee
yeah.
machine and the kombucha fridge?
Just mainly just to like, prioritize socializing, and that community library is actually quite popular and gets a lot of books in and out. Just take one, read one. A couple of areas there just to break out and socialize if members want to. And yeah, we've even got some members in the chat today, so someone have to get on here and yeah, tell me that they love socializing up in the gym. But this is their space that they have in the old Chifley building for them to come together. And that's pretty much it. So yeah, thank you for your time. Any questions? Looking forward to, yeah, helping you take that next step to better health.